this area of the face where we've got the mandibular nerve, the peripheral mandibular nerve, if I remember the right name for it, is actually this part of the face, or this part here, which we're actually going to show you with a pencil, which is this part. So even, I mean, if you follow the software here, it doesn't tell you to actually go and treat this area, but it tells you to treat the whole mouth, which you can, but not here. In theory, you can also use the treatment there, but we're going to avoid it anyway. So it tells you to treat this area, to treat this area here, which we're going to do. Okay? Then we're going to go and use the 3.0 and show you what changes in the 3.0 millimeters, which is the cartridge that goes up to 3 millimeters inside the skin. And that goes again into this part of the cheek here, this part of the cheek. It doesn't actually tell you to perform the treatment there, and it tells you to perform the treatment over here, so which we're going to do. But it doesn't tell you to do anything over there. The point is, at this point, at this moment in time, with this cartridge, you may even reach that peripheral mandibular nerve. I do apologize if I don't use the right term, but it's that nerve that starts and goes all the way from here, and it goes up, and it goes up here. So you've got to avoid the treatment in this area with this cartridge, and also we're going to tell you where to avoid it as well. This is the most popular area to avoid, but we're going to tell you where to avoid it as well. Now we're going to go into the 4.5. I'm going to show you the change in software. Change in software. As you can see, with the 4.5, only tells you to perform the treatment there, which is in this area here. You can actually go up until there. Alright, so it tells you exactly where you can treat the face, which is extremely useful, and also tells you per area, and also in that area as well, per area. It tells you roughly how many shots you can put in place. And then we've got the body, but we're not going to talk about the body at the moment. We're going to talk about the body later on, and we're going to start the treatment with a 4.5 to show you how it is done. Now, first of all, we're going to talk about the power setting once again. If we go, as I said before, you can change the power setting here by increasing this to the maximum if you wish. Now we're going to talk about the power setting in a second. Then we've got the advanced power. You have to long press that key button, and at the moment I have the 3 at maximum. So we're going to go back. Going to go back here. So everything is at 0%.